Happy New Year, everyone. Welcome back. Hi, Martin. Good to see you back this year. Right, let's get going. I think we might have a few new people involved this morning. Let me just check what's going on with everything, make sure everything's working okay. So if you are new and don't know who I am or what we do, this is me. My name is Mike. I am the Education Director for Movement Therapy Education in the UK. And we've been teaching therapy courses for around about 20 years. And I've been in the industry for 30 years this year. I started off in the gym sector and doing gym instructing, and then moved into sports injuries and then into kind of more clinical side of things. So that's my background. I've been teaching for anatomy for 20 years. And it was in lockdown that I started doing this and online stuff, because obviously we couldn't teach face to face. And we're on episode 192. So it's obviously been doing okay because we've been going this long. So what we do is we go through every part of the body. We start at the feet, and then we go through the layers. So we'll go through from the deepest layer, so from the bones and the joints. Then we'll add on the connective tissue. Then we'll add on the muscles and the tendons. Then we'll add on the nerve and the blood supply. And because of the nerve and the blood supply, we'll also look at the dermatomes and the skin. We've got quite a few videos for each section. And so this one today is, well, it might go into next week as well, probably will. It will be a section on the nerves and the blood supply for the neck. So we've had a look at the cervical region over the last few weeks. And so we started off with the bones and the joints, and then all of the connective tissue, the ligaments. We added on the hyoid muscles just before Christmas, before we broke up. And now we're into the last section where we're looking at the nerves and the blood supply. If you're new, then you've caught us right at the end. And then when we move away from the neck, we'll go down into the shoulder, then into the elbow, then into the wrist and hand, and we'll do the same again, and then we'll go around the whole body again. To go around the whole body, it takes just over a year. So you've got, which is, well, around about 60 hours, I would say, for going through absolutely everything. So hence we're on episode 192. This is the third time around the body, and some people have joined me for those three. And each time we add a bit more, and then you guys learn a bit more. So we add on some new questions and just started getting a deeper understanding of things, which is really good. So without further ado, let's get going. So we are looking at, just skim through this and go back to here. Here we go. Cervical spine neuroanatomy. And sorry, I've missed a couple of good mornings. Morning, Tristan. Good to see you there, mate. Happy New Year, and good morning, Penny. I had a bit of contact from some of you guys over Christmas, so good to see you in the new year as well. Just while we're here as well, up in the top corner here, we've got a little QR code. We do a lab visits as well. So if you're interested in seeing, because some of the videos that we've got on here are from Ackland Anatomy, and they are dissection videos, and so prosected specimens basically. And what I organise is a trip to King's College in London. So if you scan that QR code, and if you're interested, then you can join us on our next trip, which is in July. So it's in the summer. Nice time to go to London. So on the original advert for this, I put down that we were going to do the nerves, nerve roots, and then the blood supply. I think we're probably only going to get time to do the neuroanatomy, because the blood supply, the neuroanatomy is when I was putting together the PowerPoints and going over them, I was like, yeah, I don't think we're going to get to the blood supply, so we'll see how we are. So Martin, I'm heading to my second year soon, to just to make sure it sticks. Yeah, good. And to be fair, I mean, obviously I've been teaching anatomy for a long time, and sometimes I read over some of my PowerPoints from the last time I did it, and I'm like, oh, I've completely forgotten about that. And it sometimes if you don't use stuff a lot, then you do forget. But the more and more you do it, the more and more it does stick. And because people often go, what's the best way to learn anatomy? And everyone said, oh, try these cards, or I did this drawing, or this was really good. And it's repetition. It's just repetition, and hopefully making it make sense as well. So not just learning things for the sake of learning things. It's giving things meaning, which is hopefully what I'm going to do today. Thank you, Tris. Yeah, been on a few lab days with us. Yeah, they're different every time, because it depends on who's there. Depends on who the tutor is, what kind of experience they've got. So yeah, every lab day is slightly different, and I think the first one as well is a bit daunting. So you're a bit a bit like a deer in headlights really on that first session. So let's get going. So we're going to have a look at the spinal nerve roots first of all, specifically for the cervicals, but we're going to have a look at the whole spine as well, and how it all kind of fits together, because we've been working our way up the spine over the last couple of months. So just move me up there, just get rid of that. Right, okay, so we've got, this is just general for spinal nerves. So we've got nerves are communication lines between spinal cord and specific regions of the body. It's like this communication network. We've got information coming into the spine, and then messages coming back out again to tell our body what to do. There are 31 pairs of spinal nerves, and we're focusing on the 8 pairs of the cervical region, so up in the neck here. If you want to have a look at any of the others, we've got a whole bunch of back catalogue videos for you to have a look at, and we've gone through all of these. So yeah, there'll be a nerve session for the thoracic spine, and one for the lumbar and the sacral plexus as well. So that those will have been done previously, and we will go back around again and do them again. So this is something to kind of understand for this particular session, is the nerve roots and what they. So obviously we'll see them in a second, but it's what they're kind of made up of. Yeah, so we've got 2 big bundles of axons called roots. So basically we've got these nerve cells which group together, nerve fibres that group together. And we've got the roots at the front of the spinal cord, and roots at the back of the spinal cord. So anterior roots are ones that are at the front, and in the spinal cord they're called ventral roots. So you can only just make it out on this image here, but I'll show you in a bit more detail in a second. So these are the ventral roots. These will be at the front of your spinal cord, so towards the front of your body. And then we've got posterior or dorsal roots. And the way to remember this is the dorsal fin on a shark is on their back. So dorsal is on the back. That's the way that I always remembered it. So posterior dorsal, they connect each spinal nerve to smaller rootlets, and we'll see these in a second. And these are smaller bundles of axons coming out of the spinal cord, and they're really, really tiny little strings. They look like little strings. So we'll have a look at those in a second. So these rootlets then join the spinal nerve to the spinal cord. Okay, so that this is the edge of the cord just here. Again, I'll show you in a bit more detail in a second. And then the posterior roots and the rootlets contain only sensory axons. So this blue section here, this is at the back. These are only sensory, so purely sensory. And then the anterior roots and rootlets contain only motor axons that provide nerve impulses to muscles, glands, either muscles or the viscera, so the organs. Okay, and that's this red section here. Okay, so we've got we'll have little rootlets coming off of the spinal cord, then they'll group together to form these bundles. Okay, and there'll be just singular bundles coming off. and then they'll join together. So the sensory part at the back and the motor part at the front, they'll join together to create what we call a mixed nerve, which is then the nerve that emerges and goes down your arm or wherever, in this case down your arm, because we're looking at the cervical spine. So let's have a look at that in a bit more detail. Let's have a look at this one. Okay, so this is going to do a little bit of an overview, and then we're going to have a look at the of the roots, and the images and the videos are from Ackland Anatomy. Okay, so if you want to get the whole video set, then you can from them. I say video set, that shows how old I am in doing anatomy. When I first started learning, they were on videos, and now they're just online, so you can get them online, and you get a subscription. So this is the whole spinal cord, base of the skull, obviously at the top there, and what they've done is they've dissected away the spinous processes of the spine. Okay, so they're taking those off, and then this is what you're left with the you can see the cord just underneath here, but it doesn't look very bright, yeah, because the cord is quite bright white, and you'll see why in a second, because there is a covering over the cord, and that's called the dura. There it is there. So it's like a protective covering, and you might have heard of a epidural, yeah, injection. So epi means upon, so we've got epidural upon the dura. Yeah, so it's in that space before you get to the dura. So this is the base of the skull. Here's the spinal cord emerging from the brain, and there is a hole just underneath in the skull, in the base of the skull where it comes through, and that's called the foramen magnum. So the foramen magnum is just about to come into the video just here. There we go. And the dura, so that sac that's around the spinal cord, is continuous then with the brain, and it forms what we call the meninges. And again, you might have heard of meningitis, which is an inflammation of the meninges. Okay, so we've got that meningeal covering, and there are 3 different layers, and the dura is one of the dura basically means durable, so it's the tough layer, and it's often called the dura mater, so the tough mother. Okay, this is the tough mother protecting your brain and your spinal cord. So there's the foramen magnum, and there is, so foramen magnum means big hole, basically. So there's the big hole. So foramen is a hole, magnum is big, so that's at the base of the skull. And then here's the meningeal layers just here. So they've got the meninges, you've got the dura, which is this layer just here. Then you've got the arachnoid layer, which looks like a spider's web. That's why it's called arachnoid. And then we've got the pia mater, which means delicate mother. Okay, so the pia is really kind of flimsy. Then you've got the arachnoid, which is a bit more web-like, and then the dura, which is the tough mother. Okay, so those 3 layers make up the meninges. And if you have a look here, there's the brain just there. So we've got these layers wrapping around the brain, and then they come round and down and then wrap around the spinal cord as well, and they're continuous all the way down the cord. So there's the foramen magnum just there, cord coming through. So this is the dura again, and then they've cut down the middle of the dura, and then there's the cord. Okay, and what you can see, hopefully, are these sections just coming off of the spinal cord. These are the little rootlets that we were just talking about. There they are, look. Okay, you can see those there as well. So that those, let me just pull that there. So that's a ligament that attaches the spinal cord in place so it doesn't move around, and it looks a bit like a tooth. So they're called denticular ligaments because they're tooth-like projections. So don't get those confused with the nerve roots. So these are the roots and the little rootlets that are connecting into the spinal cord itself, and then they come together to form the roots, and then bind together again to create a mixed nerve. So this is at the back of the spinal cord, because obviously they've taken the spinous processes off. So these will be the dorsal roots, and then at the front will be the ventral roots. Yeah, so these are the denticulate ligaments, tooth-like projections, and you can see at different parts of the spine, the roots go off in a different direction. Okay, so these are the bundles of nerves, these are the little rootlets, and then there's the dorsal root there, the sensory nerve. Can you see the ones at the front there? Okay, so they're distinctly separate at this point. So there's your anterior roots, and there's your ventral roots just there. So that's what we were just talking about, yeah? So if we go back to that PowerPoint, that's this. Okay, so there's the dorsal root, and there's the ventral root. We've got this projection, or not a projection, a kind of gathering here. This is, where there's a swelling, it's called a ganglion. Okay, you might have heard of a ganglion like in your wrist or something like that, and basically it's just a swelling of synovial fluid that's come out of the joint. And in the olden days, you used to hit it with a Bible to make it go away. Any hard object will do, not just a Bible. These days, we don't tend to do that. We tend to aspirate them with needles rather than whack them with a book. But a ganglion is a swelling, okay, and we've got a swelling of sensory neurons just here. So there'll be a lot of what we call synapses at this point, where there'll be lots of connections being made with the sensory neurons, and there'll be lots of them in that area. That's why it's swollen. So because it's on the back, it's the dorsum. Okay, it's a ganglion, so it's a swelling, and it's the nerve roots. So it's called the dorsal root ganglion, okay, or DRG, and that's on the back of the spinal cord, so the sensory area. Okay, so if you're all okay with that so far, here we go. So this is a really good image. Okay, so there's your vertebral body. So in this case, C6, and we're going to follow C6 through the kind of theme of today. Okay, and see how we go. There's your spinal cord. These are the little rootlets just here. So these are the front rootlets. So these are the anterior ones, the ventral ones. These are the dorsal ones. There's your dorsal root ganglion. So dorsal at the back, nerve root, swelling. Okay. And then here's the root, here's a root, and now they're coming together. Okay. So now this nerve here that is emerging from the vertebra, this is the spinal nerve. Yeah, and this will go on to form the nerves down your arm, so axillary nerve, muscular cutaneous nerve, radial nerve, whatever it is. Okay, but can you see here as well, we've got this little branch that comes off around the back. So ramus means branch, or rami, so anything with that nomenclature, it means a branch. And the dorsal ramus, so this back branch, supplies the skin immediately around the spinous processes, in this case around C6. Okay, so the skin around C6 will be supplied, or the sensation will be detected via this dorsal root ganglion, dorsal ramus. Okay, so this little projection here will go immediately around the back, and that will be the same for all of the nerves. And that you'll have an immediate sensory supply to the back of the spine. So this bit here is mixed. So we've got sensory coming in this way, motor coming out. So this one here is a mixed nerve, and this is the ventral ramus, so the front branch. Okay, and then there's your transverse process, and we talked about these a few weeks ago when we were looking at the structure of the vertebra. Coming through here. So let's have a look at that in a bit more detail. Okay, so just pause that there. So we've got these are the roots coming out of the neck. These are the muscles around those roots, and we've covered some of them already. So we've had a look at the scalenes. So that'll be the anterior scalene there, that'll be the middle scalene there, because all of these nerves that are coming out of your neck come out in between those two muscles usually. Okay, there will be some variation on that. And so they've come from rootlets, and then they go into those nerve roots. Okay, and that's the first bit. So the first section that we see there will be the nerve roots, and all of these roots will form the brachial plexus, which is from C5, so cervical vertebra 5, down to T1. And then all of those roots that come out there will form this crisscross connection, all joined together in a various pattern, which we'll have a look at when we get to the brachial plexus. And then eventually they will form the peripheral nerves that go down your arm. Okay, so musculocutaneous and median nerve, radial nerve. So they will come from these. Okay, but they won't just come from one level. There'll be bits of that nerve at the end that come from various different sections in the spine, and we'll have a look at which sections come from where. So let's follow this through. So there are your scalenes. There's your pec minor. That's your deltoid, clavicle. So peel the pec minor back, and then these are all the nerves for the arm. Okay, and then here are your roots, just here. So scalenes there. That's a blood vessel there. That's a bit thicker, that one. So these are all the roots, and this is where they come from. Ooh. Pop that there. There we go. Let me just pause that there, and that's what I wanted to do. So we've got C5, C6. They then come together to form this trunk called the upper trunk. Okay, so when we get to the brachial plexus, I'll show you how to draw it so that you can use it for revision if you need it for revision. But this is the first thing to do. So you make a Y on its side, I, Y. Okay, so that's the first section of the brachial plexus. So C5 and C6, they join together to form the upper trunk. C7 then is on its own to form the middle trunk, and then C8 and T1, they both join together to form the lower trunk. Okay, so by the time they get to the end of all of the connections, which I'll show you in a second, but we won't go into it in much detail on this one, that it will then end up with the nerves that you've all heard of. Okay, but they all come from these nerve roots. Some of them, all of them. Some of them. And yeah, so it can get quite confusing. So I'm just going to do it a little bit by step by step. So these are all your roots, and then these are the trunks. So if I just pause that there, so there's your Y, C5, C6. There's your I, and then there's your other Y there from C8 and T1. Okay, that bone there, that's your clavicle. So you can see how close these nerves are to the clavicle as they go underneath. Now obviously this has been all dissected, so it's not just bare like this. There's all of the spaces in the body are usually filled with fat, so that is an amazing dissection where they're taking all the fat away so that you can see the nerves underneath. Okay, so all of these white ones are the roots, and then the red is the trunks. So upper, middle, and lower trunks. There you go. So that's what we were just looking at on the images before with the blue background. Okay, so this is what we've just seen. So we've got spinal cord, ventral root, so motor, coming out of various or a specific section of the spinal cord. And then we've got the sensory roots going into a specific section of the cord, and we'll talk about that later. We'll add the layers on. So the ventral root at the front is motor. So this is information coming out of the spinal cord to a particular part of the body. So we've got somatic motor neuron, which means a body motor neuron going to a muscle. Okay, so if you want to move your arm, there will be a message sent down a specific motor neuron, or to several of them, to activate a muscle, and then that muscle contracts. Okay, if there's significant stimulus, then it will contract. And then we've got visceral motor neuron. Now visceral is to do with the organs, so it may be to contract something, or it might be to secrete something. Okay, so depending on what where it goes to and what it needs to do. And if we have a look here, so that this yellow section here, this is the mixed part of the nerve. So we've got some sensory nerves here as well. So these are coming from the body back into the spinal cord. We've got visceral sensory neuron, so guts, basically, organs, sensory neuron. So information coming from your organs back into the spinal cord, back up to your brain to tell your brain what is going on in your digestive system, for example. And then we've got somatic sensory neuron coming from the body, so joints, muscles, skin, that kind of thing, letting your body know what the resting tone of a muscle is, or where your joints are, so the position of the joint, whether there's any swelling in the joint, or whatever it is, whatever sensation has been activated, that information will go up the sensory neurons and then into the spinal cord here. Okay, so this particular section here, the red section, this is purely sensory, this is purely motor, and then when it gets to this bit, then that's mixed, okay, which is what we saw here. Yeah, so sensory, motor, mixed, just there. Okay, cool. Hopefully all good so far. Right, let's have a look. Penny's asked a question. So do we know the reason why the roots come out independently and then join? Also, why dorsal sensory and ventral motor? It's to do with embryology, with the dorsal and sensory sections, and we'll talk about that when we get to the embryology section. So we'll do I mean, God, that's probably a whole 2 years, maybe 3 years of learning all on its own. So I'll do an introduction to embryology, and that will hopefully answer the kind of dorsal ventral section question. And do we know the reason why the roots come out independently and then join? There'll be lots of different fibers, and it's for protection as well, because if you have a problem with one of them and you only have one, you knock out everything. But if you have many doing similar kind of jobs and you knock out one, you still have others that can take over the job. So it's a bit of a kind of survival of the fittest thing, and that's what happens during embryology as well. So when you and that's why we have anomalies with the body, because as the nervous system is growing, you start off as like a sausage with tiny little arms, and then as your arms grow out, the nerves get pulled along with the muscles, and at the time that you're developing, there'll be lots of nerves attached to a particular muscle, but the strongest connection, so the strongest nerve impulses, will be the one that survives. So and the other ones will just atrophy and just die away. So you'll be left with the strongest version. Okay, so there'll be lots of, and then within that nerve, there'll be lots of different fibers go into the same muscle. So if you have, like I say, if you have a problem with one, then something else can take over, so you can still function. So I would, hopefully that answers your question. This might help as well, because I think we always think of a nerve as like being just this solid band, but actually it's structured very similarly to a muscle. So similar to muscle fibers, the endomysium, perimysium, epimysium, or mesium, whatever you want to call it. The nerves are also surrounded in connective tissue. So we've got a bundle, okay, and this fascia around each of the nerve sections. And but in the nerve is called endoneurium, so that's the innermost layer surrounding each axon. So that's this one here. Perineurium around a fascicle, so that's a bundle of axons. And then epineurium, which is the outer one, which surrounds all of the bundles. Okay, and then that's what we see. So we see the epineurium, but under a microscope, you'd be able to see these, but you wouldn't be able to see them with the naked eye. Okay, so we've got all of these axons in bundles, and then the bundles in the nerve, and then that's what we see is that nerve. Okay, so yeah, maybe that helps with that first part of your question, Penny. So we've got rami branches, which I talked about already. So this is a top-down view of a thoracic vertebra. We can tell that by the shape of the body. Here's your spinal cord. You've got the ventral roots out the front, dorsal out the back, and then immediately coming out of the back is this posterior or dorsal ramus, which we talked about before, and that will supply the muscles and the skin of the immediately at the back. Okay, so almost as soon as the spinal nerve passes through the intervertebral foramen, it then starts to split into branches. The dorsal ramus is deep muscles of the back and the posterior skin. So it will be all of those muscles that sit in the gully, where you can see it here. So we've got transverse process and spinous process here. So all these deep muscles of the back, of the neck as well, that are around the spinous processes, they'll be supplied by these dorsal rami. Okay, cool. So what does all that mean, and how do we give it meaning? I think this is a really good way of working out, especially the sensory part, because we've looked at the muscles already, and I think the sensation side is a little bit more difficult to understand. So we've got so I've called it dermatomes and cutaneous fields. So dermatomes you might have heard of, cutaneous fields maybe not so much. Okay, so we'll explore both of these. So dermatomes are to do with the skin. So derma means skin and tome means a section. So we'll have a sensory supply that supplies or receives information from a section of skin. Okay, and it's from a specific for a specific region from a specific area. Okay, so if we have a look at this, you've probably seen these before. So remember that the sensory part is the dorsal part, so that this is the bit that we're focusing on. So information coming from the body and then traveling along the various nerves into a specific area. Okay, and then that's going into the dorsal root of the spinal cord, and then going up to the brain, and the brain working out the information. Sometimes that information is reacted on immediately. So for example, like a reflex. So if you touch something hot, it's immediately picked up in the skin, and then a message will be sent straight to your spinal cord and then immediately to the muscles to withdraw from that sensation. It's a reactive thing that your brain doesn't need to get involved with, but your brain will still get the information to say you have touched something hot. Okay, but to get you out of trouble quickly, we've got a reflex that is just that loop. Okay, so from the sensory information straight away synapsing in the spinal cord to the motor section, which tells you to move your arm out of the way. Okay, so if we have a look at if this area here, so that, see this one here, you've got C6. Now, if you look at different dermatomes, you'll maps like this picture, you'll see different sections, and it's because there are lots of crossover. Okay, so it's not wholly accurate, that these kind of things. They give you a general sense of what's going on, but I'll show you the more accurate stuff in a second, but we need to kind of understand this first. So this is important when we're trying to establish whether there may be something wrong with someone's neck and the nerve root, so where that information is coming in to the spinal cord, or if it's something more peripheral, so somewhere along where that sensory nerve is traveling from the skin to the nerve root, something has affected it along the way. Okay, so we need to work out, is it the neck or is it something else? Okay, so a dermatome, and even then it's not entirely accurate. So we have a good idea, but you would need to, in a clinical setting, you would need to send them away for more testing to work out exactly what's going on. So a dermatome is an area of skin innervated, so kind of switched on, if you like, by a single spinal cord level. So C6 innervates all of that kind of pale yellow section just there. Yeah, see that all along there? So from the shoulder tip all the way down to the thumb. The sensation is received into C6, okay? But not necessarily a single peripheral nerve. So it's not like the median nerve supplies this area, or the musculocutaneous nerve, or the radial nerve, not just one of them, it's several of them receiving information from somewhere along here going into C6. Okay, we're going to start to unpack this a little bit and hopefully make some sense of it. Okay, so if we have a look here, this is the radial nerve. So this is from C5 to T1. So there'll be elements of this nerve that send information back into those regions of the neck. Okay, so if you notice, this is from a really good book. It's by a guy called Whitaker. I think it's Robert Whitaker. It's called Instant Anatomy. Really, really good book. Makes very complex things very simple, which is what I like. So if we have a look here, you've got these little endings on these lines here. So where it's a Y shape, that is motor. And you can see, so that's going to the long head of the triceps, that's going to the medial head of the triceps. Where there's a circle on the end, that's sensory. So this is the posterior cutaneous nerve of the arm, and it supplies the posterior upper arm skin. So the back of your triceps, basically. So that section there is sensory, okay, and then that goes along the radial nerve back into the neck. This one here, posterior cutaneous nerve of the forearm, so posterior forearm skin. So remember, if you're standing in the anatomical position, then it will be the area that is supplied over the extensor muscles, all this area of your forearm. Okay, and then again we've got the inferior radio-ulnar joint, so sensation from the joint itself, sensation from the wrist, sensation from the dorsal part of the hand, so the back of the hand, okay, and then this last one here, the elbow joint, so sensation from the elbow, and then all the others, the Y-shaped ones, those are all motor. Okay, so this is what the radial nerve does. It will send information to these muscles, and it will receive information from these either areas of skin or the joint. And so we've got the joint branches are called articular branches. That's basically what that means. It means a joint branch for sensation. So if the elbow joint is being pulled excessively in the wrong direction, you'll get a sensation from the elbow joint going, please don't do that. So the muscles will then try to contract to protect the joint, or if there's swelling in the joint, if there's heat in the joint, something like that, it will be picked up by those sensors and then send the information back up to the spinal cord. Okay, so what we've got then is motor axons and then sensory axons in a mixed nerve. Okay, right, here we go. So if we have a look at C6, okay, if we continue with C6, so that route there joins into the upper trunk, and then with various divisions, it will go off and it will supply part of the musculocutaneous nerve, part of the axillary nerve, part of the median nerve, and part of the radial nerve. So from C6, there'll be elements of rootlets, axons from C6 that will contribute to these four eventually branches. Okay, so the nerves we all know. So hopefully you've heard of some of these before. So musculocutaneous nerve, axillary nerve, median nerve, and radial nerve all have a contribution from C6. Okay, and this is important for the next bit. So we've got a start point in the skin. Okay, so the same start point. And if you remember going back to that dermatome, so C6 covered all of the kind of outside of the arm down to the thumb. Yeah. So that area there is all C6. We've got the same end point, which is the nerve route. So we're going from Birmingham to London. But you might have a different route to get there. So the sensation may travel via the musculocutaneous route or the median nerve route. I've only done 2 examples, but it could be axillary, depending on where the sensation is lost along that C6 area. Okay, so we've got different ways for the peripheral nerves to receive information into the cervical spine. Okay, cool. So then we've got cutaneous nerves, which is what we've just seen on that radial nerve diagram. So remember, the radial nerve had a branch that supplied the back of your tricep and a bit on the forearm, and then on the bit on the back of the hand. Okay, so there's certain sections that the radial nerve will receive information for and send information back to the spinal cord. So a cutaneous field is an area of skin sensation supplied by one peripheral nerve. So remember, the dermatome section was supplied by 4 peripheral nerves, but the cutaneous bit, so the back of the arm, is mainly radial. Yeah, hopefully that makes sense. So you've got certain sections which are from certain nerves. So if you have a look at this, we've got C6 here, and see that this is a different map again. So we've got this dermatome map showing C5 and C6, whereas the other one was C6 all the way up. So let's say that we have a problem with the nerve root. Okay, so it doesn't matter whether it's C6 is coming from the forearm, it's coming from the thumb, or it's coming from a little bit higher up. On that last image, it was a little bit higher up as well. You can't receive any information from that whole area because the nerve root is injured. Okay, there's a problem with the root. So if there's a blockage here, it's not going to get anything in. Okay, and that's the same with the cutaneous fields as well. So there'll be a specific section here. So we've got the lateral cutaneous nerve of the forearm, so that section there and that section there by the thumb, both of those will be blocked as well. So if there's a problem with the root, it blocks everything. Okay, and you won't. You'll have either an odd sensation or no sensation to that whole region, which will be the whole dermatome. Yeah, so the whole dermatome will be affected. So is it some, is it all, or is it none? It's all. Yeah, because the nerve root is affected. Hopefully that makes sense. If it's just one of the nerves that's affected, then it will only be some areas of skin that will be affected, because the other peripheral nerves can pick up the sensation from other areas. So if we have a look here, so we've got musculocutaneous supplying around this area here, C6 in the C6 dermatome. If that nerve is affected and just that nerve, the median nerve can still sense other areas, the axillary nerve can still sense other areas, and the radial nerve can still sense other areas. But the area that's specifically supplied by the musculocutaneous nerve, you won't be able to feel that section. Okay, so that will be some. Yeah, so it will be a specific cutaneous field. So that nerve supplies a specific area of skin. Okay, but if it's the nerve root, it's the whole lot. Hopefully that makes sense. So if you injure a nerve root, you lose sensation in the entire dermatome. So that entire section is knocked out. If you injure a peripheral nerve, then you lose sensation in its cutaneous field. And if we go back to the radial nerve, so let's just switch back to this one. So have a look here. We've got posterior cutaneous nerve. It could just be that area there that's affected. So maybe you've got some kind of compression or injury of that particular cutaneous nerve. So it's only the back of the arm that feels weird. But if you knock out the nerve here, the mixed nerve, it's going to affect the sensation here, sensation here, sensation there, sensation down here as well. It's going to knock out the whole lot, because the radial nerve, if it's blocked up here, it's not going to receive any information. But you'll also affect the motor parts of that radial nerve as well. Okay, so if it, let's say it's this bit here, there's a problem just here. So around the elbow region, the posterior cutaneous nerve of the forearm that supplies that posterior forearm skin, if it's just that nerve that's affected, it will be just that section of skin that's affected. But the muscles will be fine. Other sensation areas will be fine as well. It will just be that area of skin. Okay, hopefully that makes sense. Okay, just going to show you one more thing because I know we'll run out of time. This is how I would kind of like simplify it. Okay, so we've got the skin here in Birmingham. You've got a sensation in the skin, and that information needs to travel along the road network to get to London, to get to the neck. Okay, if there's a crash in London, then nothing's getting to the destination. Doesn't matter whether you're trying to get it through the median nerve, the musculocutaneous nerve, the radial nerve, whichever one it is, the C6 section is blocked, so you aren't getting anything through. Okay, so the whole dermatome will be affected. But if it's just the musculocutaneous nerve that's been affected, so this route here, the median nerve can still pick up some of the slack. The radial nerve can, the axillary nerve can, which are other areas in that C6 dermatome that will go into the C6 area because there's into the nerve root, because there's no problem there. The problem is with this specific peripheral nerve. Yeah. So there's a car crash on the M1. Sorry if you're not from the UK. It's one of our motorways. The musculocutaneous nerve. So instead of the M1, we'll use the M40. So this one instead. Okay. And it's got nicer services too, but not as nice as Gloucester. So if you ever come to the UK, go to Gloucester services. So you've got musculocutaneous nerve just here. That's the one that's been affected. So that one you won't get any information through, but this one you will. So it won't knock out the whole section. It will just knock out a specific skin field. Okay. Hopefully that makes sense. So, however, you know those dermatome maps that I showed you, and then I showed you two different ones. How confusing is that? These are the points at which the dermatomes are consistent. Okay, so if we have a look here, so there's C6. So the most consistent point to check C6 is in the thumb. Yeah, because that is the only point along the whole dermatome that just comes from C6, and that's it. Nothing else contributes towards that area. So if you want to check C6 sensation, use the thumb. If you want to check C7, you use the middle finger. C8, little finger. C5, just there on the side of the elbow. Okay, so if you do a test up here for C5, you're going to get a little bit of C4, a little bit of C5, a little bit of C6. Yeah, but that specific spot there, specific to C5. So if you're doing dermatome testing, this is the map to use, because this has been validated and it's really, really accurate. Okay, or the most accurate things that one of the things that we can use that has the most accuracy. Okay, if I can dig myself out of it, nothing's 100%, is it? So yeah, hopefully that helps. Hopefully that makes a bit of sense. Okay, we're going to delve into a little bit of embryology next week, and a little bit of myotome stuff as well. to build on from this dermatome testing. So, but like I say, it's all very well known about the nerve roots and where they come out and all that kind of stuff, but what do they do? This is the real crux of it. And when you understand the anatomy, then what it does then makes sense. Hopefully, right? Hopefully, cool. Right. Happy New Year. That was a nice one to start 2025 on. I will see you next Monday, 10 o'clock. See you then.